Hi, good evening. Today we are going to discuss about the medical coding. So, what is medical coding and how the medical coding is working, and who are the eligible candidates for to do this medical coding, and all we are going to discuss in this session. So, let us start. So first of all, what is medical coding? So nowadays, medical coding is a very booming industry in a great career opportunities, and especially in the during the pandemic situation, uh, this medical coding is raised like a anything. So it is having a plenty of opportunities, and lot of people are do this course in this pandemic situation, and they got placed in various companies. Even in healthcare industry nowadays, it is a very fast going industry, and who are seeking for a job, they'll definitely choose this medical coding as an option. And first of all, we have to know that first of all, what is medical coding? So medical coding is a unique process. We have to translate the document, like medical history. We will medical document is there, no, that we need to convert into a simple alphanumeric code. So whatever the medical services is taken in the hospital by the patient, that everything medical record we are going to translate into some alphanumeric codes. Previously these alphanumeric codes are usually in previously they used to code in only numeric codes. Now after the 10th revision, they used to code alphanumeric codes. So these codes are universal in nature, and these words we have to use to code the some medical diagnosis and some type of services, like surgeries and minor surgeries and major surgeries, and some type of clinical services like laboratory services and radiological services. All we are going to convert into the codes. So how many types of codes we have used in this medical coding is, normally in United States they are having 6 type of HIPAA mandated codes. So these HIPAA mandated codes are available in 6 formulations. One is ICD-10-CM. So in ICD-10-CM means it is International Classification of Diseases, 10th revision and clinical modification. And coming to the second type of course, these are CPT course. CPT is nothing but current procedural terminology course. And coming to the third one, HCPCS level 2 course. So these HCPCS level 2 course, usually we can use a level 2 course which are appeared like in some categories of laboratory course, and some type of secondary course we can use from this HCPCS. This HCPCS is Healthcare Common Procedural System. So Healthcare Common Procedural Coding System level 2 course. And coming to the fourth one, ICD-10 PCS. This ICD-10 PCS is nothing but, so International Classification of Diseases, 10th revision, and here in PCS we can use the procedural coding. So it's a procedural coding. And coming to the fifth one, it says CDT. CDT is nothing but codes on dental procedures and nomenclature. So these are the codes we can use in the dental coding. And coming to the NDC, National Drug Codes. So these codes we can use in the to code the drugs. What are the medications is prescribed by the physicians? In that scenarios we can use these NDC codes. So there are 6 types of codes we can use in the coding system. Mainly we will use ICD-10-CM, CPT, HCPCS level 2, ICD-10-PCS, CDT and NDC. So usually in India, the coders mostly working on this ICD-10-CM CPT and HCPCS level 2 codes. Mostly we are working on these three type of codes, and very rarely they can they can work on the PCS, and dental coding is very rare. So drug codes are commonly we can use supplement. And coming to these, why should you do this course? Why should you do this course is, it's a very helpful system that plays a key role in modern healthcare options, and nowadays all organizations are communicating effectively with each other, and also the healthcare system is also throughout the India and throughout the world we are doing. So usually we are working from the India for in US project in this. So in this scenario you can understand how the world is developed. So now you can come to the know that what are the reasons to start learning medical coding or medical billing course. So why means you are working in an allied health rewarding. So working in allied health is a rewarding, means if you want to help the others, like how many people are directly help others every day. So one of the great benefit for who are having a mind to help the others. So you by here you will get a doubt how you are going to help the others by doing this medical coding. So even if you are not directly do the help to other people, even we can help the people in various aspects, like various ways are there, lot of ways are there. You can do help directly or indirectly, it doesn't matter, but you want to decide, so you have decided that you want to do some help to the others, then you have to do in a way where you have to help them. So like in this medical coding field, how you are helping means you are helping the patient by giving the accurate bills, like you will get the satisfaction when you working in this medical coding field, like where means the medical billing specialists are very vital part in this medical coding, and medical coder or billing specialist are very vital parts. Why? Because is we are doing the cost cutting or cost reducing in medical mistakes, like generally patients who are having these medical histories, they are organized and correctly recorded by the coders. So we are giving accurate codes on that, means it is very helpful to the insurance company, physician, and as well as the patient. So here the three category of people are very beneficiaries on this project. Why? Because we are doing the help for every these three people. So by doing this job, definitely end of the day you will get that some type of self satisfaction by reducing their cost of the treatment, and you will give some uh, for example, you are working you are working for the patient side, means you have to do the benefit for patient. At the same time, you are regulating the insurance companies, what are their mistakes and all. You are going to rectify those mistakes, and you will do the benefit for the patient. At the same time, if you are working for the insurance company, you are going to help the insurance company behalf of the insurance company. So you have to do the accurate coding for insurance company to give the accurate bill to the patient. Actually how much they'll charge for a disease, that much of coding you are providing. So that accurate billing when you are providing, in that scenario here, the insurance company and as well as the patient both are the beneficiaries in this scenario. And coming to the second one, you will be in the middle of fast paced industry. So here in the fast paced industry means healthcare industry nowadays it is rapidly growing. So the biggest changes, or most of the biggest changes you will find in the medical uh, industry, because previously we used to preserve our medical records by using the physical written record formation, but nowadays we are having the electronical health records. So it means if you are having a health electronical health record, means wherever you are, even though if you are not carrying your medical records, wherever you are, you just have to enter into your PC and you can open your medical records and you have to take the treatment from anywhere. At the same time, if you are having an EHR choice, so electronic health records, it is very benefit for everybody. So not only does this improve the way patient medical records are shared and used in various aspects, but also their cuts of costs and improves how they're getting the outcomes and all may be improved. Coming to the third one, you don't need to go to a medical school. This means if you want to become a medical coder, there is no need to go for the medical college or medical school or nursing college, something else. So if you are if you are a normal um, bachelor degree holder, so you have to complete your 3 years or 4 years bachelor degree in your hand, and then you will have a chance to become a medical coder. So there is no need to do all the medical courses and all. So there is no need to um, spend a lot of monies on that, and there is no need to spend lot of time on that. So you just have to hold a normal degree in your hand. Coming to the, you will have your pick of locations. This means if you want to change your career or else if you want to change your location, so in your location you are having only two big companies and you don't have a chance to work in those two companies, but you want to work from remote areas, so then you will have a facility in medical coding to work from home, and as well as uh, you have plenty of opportunities in medical coding. So wherever you are living in that area, definitely you will find a medical coding company or else medical remote work opportunity you will get. And coming to the, you can start a new career in just a few months. So uh, mainly some people are considering their mid career change probably, so they want to change their career option and they just wanted to become a medical coder. There is no need to wait for years and decades for this course. Just you have to do 3 months course, that is enough, and then after 3 months you have to complete your certification, then you will become a medical coder. Next, earn a great medical coding salary. At present, we are having the census of 2023, and the average Indian medical billing and coding salary were more than 80 lakhs, sorry, 8 lakhs, which is a higher than average Indian income. So these numbers can fluctuate or depending upon the location, the type of employment you are getting, and the amount of experience you are holding. Based on these amounts are vary. Either it will be 8 to 10 lakhs or 12 lakhs, depending upon your experience. It may be vary, but on an average, definitely you will earn 8 lakhs per month. And after jobs, after studying medical coding. So after finishing of this course, what are the job opportunities you will find? So there are number of job opportunities available for these individuals who have studied medical coding, including medical coding specialist. First one is medical coding specialist. Medical coding specialist is nothing but they review the patient record and assign some appropriate course as we discussed earlier. So they have to assign for particular disease or particular procedure or particular based on the classification they can use to code. If it is a disease, they can take the code from ICD category, and if it is a procedure, they can take the code from the CPT procedure, and based on the category of visit they can do the coding. So this is the main role of the medical coding specialist. Coming to the medical billing specialist. So the medical billing specialist is usually codes assigned by the medical coder. So who are completed the coding part, these codes are these codes uh, after the coding they'll send to the medical billing specialist to complete the claim submission. So the billing specialist can do the create the claim and they can submit the claim for the insurance companies for payment to the insurance companies for the payment. So this is the medical billing specialist work. And coming to the health information technician, so HIT, so health information technician is nothing but he works with the patient records like coding and some abstracting information for use in the healthcare management and research. So they can use the same coding part and abstracting part. Coming to the clinical documentation specialist. So clinical documentation specialist role is mainly he works with the healthcare providers to ensure that patients records are complete and accurate. So when the physician after the visit of the physician their records are completely written or not, that they are checking. So including they're coding the diagnosis and procedures are well coded or not, that they will do the in clinical documentation specialist work. So coming to the medical record technician, so what he will do is the medical record technicians works with the electronical records. Electronical health records are there, no, and they work on the electronical health records and other healthcare information systems like including coding and abstracting patient information on these topics they will work. And coming to the salary after the medical coding study, so mainly the salary for the professional in medical coding can vary depending on a number of factors like their level of experience and the level of industry they are where the industry they are working and where their work is like a location. So based on these categories, their salary may be fixed. According to the US Bureau of Labor Statistics, the median annual wage for medical records and health information technicians, like including coders, that was like $44,010 in May 2023. So now the salaries can range from 30,000 to 60,000 per year or higher. So depending on the individual's level of experience and specific job role. So here you have to important thing is you have to uh, take down these three figures and just estimate and are intended to provide a general sense of the salary. Based on this salary, it may be vary according to the location of the work you are working and place of working and at the same time company where you are working and based on your experience, the level of knowledge as well. Coming to this, who this course is for. So mainly who can do this course. So anyone with an interest in healthcare and medical terminology can study this course. Usually the life science graduates and who are having a normal 4 years degree in their hands, they can eligible to do this course. So a normal bachelor's degree who are holding, that people are eligible to do the medical coding. Thank you guys. If you understand the valuable information which is provided here, and I hope you will all understand the what is medical coding and how it will works and what are the packages that you will get and who can do this course and everything you understood. And thank you guys, thank you for this opportunity, and looking forward to who will be interested. Thank you.